Today we're going to talk about selecting denture teeth. Remember that your technician doesn't get to see your patient, and they need something to give them guidelines on how to set the teeth. So they use the wax rim contours and the reference lines that you provide. That helps to establish the occlusal vertical dimension, the angulation for the lip support, the horizontal overlap, and a guide for the size and positions of the teeth. So when you're making your wax rims, you're going to place some reference marks on the wax rims to aid in tooth selection and placement. Let's look at the maxillary reference lines first. By far the most important reference line is the midline. It is critical to get that position correct and the angulation right. We'll also talk about the high lip line and the corners of the mouth. Let's take a look at each of these reference lines now. The midline position, as we said, is a critical reference. Score a line parallel to the facial midline using your number 7 wax spatula and make sure that you mark it on both the maxillary and mandibular rim. You may find it helpful to use floss or a tongue blade or your number 7 spatula to aid in marking that midline on the rim. You can use those reference lines and sort of place them as close as you can to the overall facial midline, tilting them back and forth till you think you've got it just right, and then transfer that mark onto the wax rim. Usually the maxillary mark is placed first and then transferred to the mandible. The other line that we will scribe on the maxillary wax rim is the corners of the mouth. This is the position normally of the distal of the canines. Again, we use the number 7 wax spatula to do that. Once you've made those corner of the mouth reference marks, you can use the True Auto Rule to determine what the size of the 6 anterior teeth are. You can either measure that in millimeters and figure out what the corresponding mold should be, or you can read off the letter code, which will give you the approximate size of the maxillary anterior teeth. The high lip line is the last maxillary reference point that we will talk about placing on the wax rims. It's the highest point of the upper lip when the patient is smiling broadly. Normally, the cervical necks of the anterior teeth lie at or above this line. If shorter teeth are selected, oftentimes you'll see a lot of the gingiva, something we refer to as a gummy smile. In normal relationships, this doesn't look particularly good. Here are some examples of patients showing the high smile line, and you can see that the cervical necks are tucked just underneath the maxillary lip. Other lines that we may need to draw on our casts and on our record bases are the palatal midline. This goes through the center of the incisive papilla and through the mid-palatal raphe. You want to extend these lines onto the land areas so that you can use them as reference points for setting teeth in the wax. If you don't transfer them to the record bases, they'll be covered up once you put the wax rims and the record bases back on your casts. The idea here is to use these lines to make sure your setup is relatively symmetrical on the casts. The midline and canine reference positions are important. Normally, a line passing through the distal of the incisive papilla and perpendicular to the palatal midline intersects the cusp tips of the canines in a natural dentition. When we look at the distal aspect of the incisive papilla, this can be used to provide a verification of tooth size and selection. Normally, on average, the facial of the central incisors should be 8 to 10 millimeters anterior to the distal of the incisive papilla once the teeth have been lost. Those are the maxillary reference lines. Now let's look at the mandibular reference lines. There's a few things that you should be recording on your cast and then transferring to your wax rims. One is the center of the posterior ridge. The other is the center of the anterior ridge. Let's take a look at each of these in sequence. Normally, we want to determine where the middle of the retromolar pads are. The occlusal plane should always intersect the occlusal plane someplace within the retromolar pad. If the occlusal plane is set too low, what happens is the tongue laps over top of the teeth, and when the patient goes to chew, they bite their tongue. If you set the occlusal plane too high in the posterior region, the tongue has to really strain to place the bolus of food back on top of the occlusal table of the posterior teeth. And normally you'll find that the patient says they have a sore throat or they feel tired at the end of the meal. We said that the center of the posterior mandibular ridge is really important. To ensure mandibular stability, we'd like to have the maxillary lingual cusp, which are going to be our main functional cusps, centered over top of this line. This reduces fulcruming forces during function for the patient. Anterior denture teeth we would like to place in the same position as the natural teeth. That's impossible to do, or it's difficult to do, because if you place them out where the natural dentition was, you'll find that normally, because the denture isn't anchored in bone, you're going to have a denture that tips and loosens. So normally we find that the natural anteriors are proclined facial to the ridge, but after extraction, resorption occurs primarily from the facial, and you end up with the residual ridge somewhat palatal to where it was. If you were to place the anterior teeth for your denture in exactly the same position as you did where the natural teeth were, you would probably find that those teeth would be anterior to the ridge, and as the patient bit down, would cause a teeter-totter effect or a fulcruming effect and cause tipping and loosening of the denture. So normally we try to place these a little bit facial in order to get the lip support we want, but not so facial as to cause tipping. Here's an example of what would happen if we were to place the teeth too far facial. As the patient bites down, it causes the denture to tip and tilt off of the ridge. When you're finished watching this video presentation, you should go to our website and take a look at the reference line video that we have there. I'll give references to those at the end of this video. When we're selecting anterior teeth, you should think about this as being both an art and a science. So there are some measurements and formulas that we use as starting points, but there are no sure formulas that give you exact sizes and shapes for teeth just using these mathematical determinations. So we use our vision and we use common sense to make sure we've picked something that looks good to both us and the patient. One of the first things that we'll be picking is the tooth size. We'll use the patient's existing teeth as a guide. Take a look at them with their denture in place and determine if both you and the patient think that the teeth are either too big or too small. And if so, use your judgment to determine whether you're going to pick a bigger or smaller tooth. It's really important to know if the patient likes them, but it's also important to give your opinion to the patient. When we use the existing teeth as a guide, we would, if we determine that the teeth are acceptable, the easiest thing to do is to measure the width and length and compare to our True Bite mold guide and picking a tooth that's similar in size and shape. You will have both a paper guide and there's an electronic guide, and make sure that you're looking at the proper sizes of teeth. When you're making your measurements, the easiest way to do that is not to use a ruler, but to use a Bowley gauge to measure both the length and the width in millimeters. Sometimes we will ask the patient to bring in photos of themselves. Sometimes it gives us some clues to what their natural teeth look like. It's important when you ask them to bring in a photo that you ask them to bring in a photo with them smiling and their teeth showing. The high lip line is an indication of the incisal-gingival length, and as we said, the neck of the tooth should just be underneath the upper lip when the patient smiles. If you have an existing denture where you like the size of the teeth, it is an easy method for determining the proper size of the maxillary 6 anterior teeth by stretching your True Bite ruler starting at the distal of one canine and keeping the ruler tight against the facial surface and wrapping it around and reading off either in millimeters or by the letter size what the size of the teeth should be that you want to pick. Shape is also important when we're selecting teeth. the Dentsply guide was initially set up to provide shapes of teeth that were ovoid or rectangular or tapered, and or combinations of these things. It's a good starting point, but it actually has been proven that it doesn't correlate with facial shape. Other guides try to correlate between male and female characteristics, so they give characterizations such as square and angular and strong contours being male, and soft and rounded contours being related to female. Again, none of these systems have been shown systematically to correlate. So again, you need to use systems as a starting point, but use your eyes and your good judgment when picking size and shape. When you first start selecting teeth, you may find that it's difficult to do. A common technique that's often used is to use negative space, so that rather than looking at the shape of the tooth itself, we try to vision the space around the teeth. Oftentimes that will give you some idea of the triangular space, the amount of taper of the teeth, and will help you pick the teeth in an easier fashion. At Dalhousie University, we use the Dentsply system for selecting teeth. You'll notice that the maxillary teeth are composed of 2 numbers and a letter. The first number refers to whether the tooth is square, tapering, or ovoid, or combinations thereof. The second number provides some indication of the proportion and contour of the tooth, so whether it is long, medium, or short in length. The last letter in the anterior mold would be an indication of the width of the 6 anterior teeth. So starting from A to G or H, it will tell you how wide those teeth are when placed on a curve. You can see here that we're looking at a square tapering tooth, 22G. You'll also notice above them that there are, in the blue, portrait, bioblend, and bioform molds available. For our purposes, we will only be using portrait teeth. And so if you see in your mold guide a guide that doesn't include the portrait, we will not be using those molds. Here's some more information that you'll see on the guides, whether it's electronic or paper. You can see just below 22G, there are 2 letters listed, O or P. These are 2 matching mandibular molds, and you can take a look at the photos in the guide to determine which of those would be preferable. Those are size match to pair with the 22G mold guide. You can also look over to the right-hand side. You can see in the red box here, we'll be looking at the dimensions of the teeth. You can notice that the length of the central incisor is listed here as 9.6 millimeters. You can also see that the width is 8.6 millimeters. When you measure the width of the anterior teeth with the bully gauge on the patient's existing denture, those are the numbers you're trying to pair up. When you use the TrueBite auto rule, you can either use the G in the 22G mold to determine what the width of your mold is, or you can see here also in the red box, we have the width of the 6 anterior teeth on the curve. Looking further, way back near the last page of the mold guide, you can see that there's a chart. That chart will list the anterior molds in the first column, and there it will give the corresponding anterior lower molds. And then in subsequent columns, it will match up with appropriate sized teeth for posterior teeth of different cusp angles. We'll go over those in a minute. So when you're selecting denture teeth, if you have an existing denture or natural teeth that look good, what you'd like to do to be the most expedient way to choose your teeth is to select the best match of size and shape for the height and width of your central incisors. So take the existing denture, measure that length and width. Confirm that width of the 6 anterior teeth on the mold guide that you're looking at, and then select a corresponding mandibular mold. If the existing denture teeth need to be changed, if either you or the patient think that they don't look good, if they're too small, or the shape is wrong, then you're going to use the best size and shape guesstimate for the central incisors. So again, try to figure out what the size of the central incisor is and work with your mold guide to select the corresponding mandibular anterior teeth and posterior molds. Another aspect of selecting teeth for dentures is to pick the right shade. We're going to use the portrait shade guide because we're using portrait teeth. Use your existing teeth on your denture as a guide. If the patient likes the shade of or color of the teeth that they have at the present, then try to match that. Remember that shade B2 is close to an average shade. The top number, A, B, C, D on the tabs, corresponds to a Vita porcelain shade guide. There's also a bottom number that starts with a P on each of the shade tabs. That is the portrait number, and that will be the number that we use for ordering denture teeth. Remember that when you're picking teeth, not to stare at the tabs too long. You should only be looking at the teeth for 10 to 15 seconds at a time. After that time, look away at something light blue. For most of the time, and for most operatories, you might have a light blue bib on your patient, and that can be used for resting your eyes. If you don't look away, or if you stare at the tabs too long, after a while it will look like everything matches whatever tab you pick. When you're helping to select your patient, when you're trying to help your patient select the teeth, don't show all the tabs to your patient at one time, and don't show them the entire guide for sure. If you do, the patient will almost certainly pick the whitest shade, whether it's a good shade for them or not. It is also important not to show the patient the shade tabs against the countertop or some other color besides what they're going to see in their mouth. The color that surrounds a shade tab affects how we perceive it. If you take a look at this diagram at the bottom of the slide, the red and the green on both sides of this chart are exactly the same hues. But because of the surrounding colors, they look slightly different. If you don't believe that, take a look at this interesting optical illusion. How many colors do you see? Most of you will say that you see 4 colors. You see orange and pink and green and blue. But if you were to take this apart, you would find that there's actually only 3 colors. There is orange and pink. There is no blue. The green shade actually looks blue when it's surrounded by a different color. Here's an example of why you don't want to show your patient shade tabs against the countertop or some other aspect. You can see that we're looking at all the same shade tabs here, and you can take a look between these pictures, given the same light and exposure, that the shades seem to change depending on what the background color is. The lesson is, always show the shades against your patient's skin. Oftentimes, we're going to try to get the patient to select the tooth shade themselves. Never try to talk a patient into selecting a shade that you have suggested. Remember, your patient will own the denture. They will look at it every day. You will not be in the room, and if you try to persuade the patient into a shade that they don't like, you may find that they come back and want you to remake the denture with the color they preferred. So, offer your opinion, but don't try to persuade your patient out of something they may choose. You can start by checking the patient's existing denture, or if they have natural teeth, checking those as well. Ask if they want the same shade that they have, and if you are trying to match the natural teeth, try not to vary very much from the natural teeth. Otherwise, it will look artificial. As we said, the ideal place to check the shades is against the patient's skin, against their their facial coloration. So check the shade against the lip, and sometimes we might tuck this underneath the patient's lip and then disinfect or sterilize the tabs later. Try to narrow your choices, and again, remember, try not to stare at the tabs too long. There's one secret that's sometimes used, and that's for checking for the brightness of the teeth. If you squint, you reduce the influence of hue or color perception, and if the teeth look too bright when you're doing a squint test, that may mean that you need something that has less brightness or less value. Remember, as you're finalizing the shade selection, as you're narrowing it down to what you and the patient think looks good, make sure that the patient gets a chance to see the shade against their lip with the mirror. Your job next is to obtain the patient's selection, their approval of a shade. Never allow the patient to tell you that you're the person who's picking the tooth color. There are a couple of things to remember as we're picking shades. It is normal as patient ages that their teeth will darken. As secondary dentin is laid down, teeth tend to become more colorful. There is actually no correlation with skin color or hair color, and so guides that are used and correlate with these are suspect. If you're looking for a tooth that's slightly grayish, the Vita C shades are such. But remember, don't use terms like darker or grayish or brownish. Patients expect that their teeth will look white. So try when you're describing shades to talk in little less color, a little bit more colorful. Those tend to be appropriate terminology that patients will accept. Most patients will never pick a tooth that you say looks darker. When you're finished, remember to disinfect the tabs after use and sterilize them if you're able. Denture tooth material is another selection that we will look at. In general, we don't use porcelain teeth in our clinics anymore. They're getting very difficult to obtain, and acrylic is much easier to set and adjust. The newer acrylics offer improved wear resistance. There are a number of different types on the market, including IPN resins and composite layered denture teeth, which last much, much longer than the first acrylic teeth ever did. In general, acrylic teeth will last the lifetime of the denture, which is normally 5 to 7 years. Some of your patients will come in with porcelain denture teeth, and it is true that porcelain wears less, and it is a little bit more translucent, since it is a porcelain. But they tend to be more brittle, and they tend to fracture easily, especially if the glaze is worn off. They don't tend to bond to the denture base, and so you'll often find a very dark line around the necks of the teeth. And sometimes you'll find that the teeth actually fall out of the denture base because they haven't bonded. They're much more difficult to set and much more difficult to adjust. Acrylic teeth, on the other hand, don't wear as well, but they do wear much better now that we have the newer materials. They have improved translucency using many different layers of acrylic, so even though they're not as good as porcelain, they're very, very good. They tend to be more resilient, and they tend to break less often because they're not as brittle. Chemically, they bond to the denture base, and that makes it so they actually don't fall out of the base unless something in the processing steps is wrong. In general, they don't tend to click together as much, and so most patients find that they're quieter when chewing and talking. They're way easier to set and adjust, and for those reasons, we tend to set acrylic denture teeth now. If you have a patient who has porcelain teeth, they won't be expecting that gum will stick to the new denture teeth. But if you do have acrylic denture teeth, you have to remember that chewing gum will stick, and that's something to advise a patient who previously has had porcelain teeth. The teeth that we use in our clinics are Dentsply Portrait IPN Acrylic. We use those routinely in our clinics, and we don't order other types of teeth. We don't select porcelain teeth, and we won't be using or selecting any of the Bioform or BioBlend molds. If the mold selected doesn't come in portrait, pick the next closest mold. For the last couple of slides that we're going to look at, we'll be talking about selecting posterior tooth form. Anatomic teeth come in different degrees: 10 degrees, 20 degrees, 30 degrees, and 40 degrees. These refer to the cusp angle of the teeth. So if you look at the photos below and you look at from the buccal, if you look at the cusp angles right at the cusp tip, you'll find that as the degree increases, the cusps get sharper. These are used for patients who are concerned that the denture teeth look as natural as possible. It's important, though, that if the patients are going to wear those type of teeth, that they're able to close into a cusp to fossa relationship. And so it's important that they have coordinated jaw movements. If you're setting denture teeth against natural teeth, if you have a single denture set against a natural dentition, these are the types of teeth you should pick and try to match the cusp angles with the natural dentition. Non-anatomic teeth, such as 0-degree teeth or rational teeth or monoline teeth, depending on the mold and brand of teeth that you're using, tend to have no cusps at all. So if you look at the buccal profile on these teeth, they look pretty flat once you get to the occlusal surface. These are used when we have jaw size discrepancies, such as angles class 2 or angles class 3. If you have very severe ridge resorption and you don't want a lot of lateral forces placed on the denture because it won't stay in place as the patient makes chewing motions, then choose non-anatomic tooth. If your patient can't reliably find one position to close into, if you find it difficult to find one centric relation position, non-anatomic teeth make it much easier to set. The one drawback to non-anatomic teeth is they tend to be poor aesthetically due to the lack of the cuspal inclines. When we set non-anatomic teeth, we don't set any vertical overlap or overbite. Normally, the horizontal overlap or overjet is still set between 1 to 2 millimeters. Although it might seem that cusp teeth would allow patients to chew much easier, the studies that have been done to date haven't shown conclusively that one tooth form, either cusped with very sharp angles, is more efficient than a flat tooth. You will find studies that show one tooth superior to another, but in the next study you'll find that the opposite might be true, or that patients actually can't tell that they can chew better with one type of tooth or the other. When we're picking posterior teeth, we want to try to match the size and shade to the anteriors. And so using the table at the back of the Dentsply Mould guide is a good way to find the corresponding size. Also, it's important to know that when you're looking at the sizes, the last 2 digits on those molds, 29, 30, 32, 34, tends to indicate the distance from the distal of the canine to the distal of the most posterior molar. It is also important when we're selecting posterior tooth forms to make sure that the buccolingual size is appropriate. If we're having problems with cusps crowding the tongue, we might choose to use smaller teeth if the tooth size is limited, if the tongue space is limited. When we're using and prescribing denture teeth, we don't use three-dimensional porcelain mold guides any longer. We only use our paper molds. We always had infection control problems with the three-dimensional mold guides. So at present, we'll either use the electronic or our paper guides. In our clinics, the paper guides are laminated and can be disinfected. When we prescribe denture teeth, again, we're going to use the Dentsply True Bite portrait molds in our clinics. These are acrylic teeth. They have layers for improved translucency, and the IPN provides improved wear resistance. In summary, when you're selecting denture teeth, advise your patient. Try to make the measurements you need and try to give them some guidance. But remember, you're not there to persuade your patient what to pick. You're there to give guidance, and they need to do the selection themselves. Use your common sense. Use your old denture as a starting point. Look at dentate patients to see what denture teeth should look like to mimic nature. Next, we're going to begin a seminar exercise, and I'll describe just briefly what we're going to do. You will be provided with a Dentsply paper or electronic mold guide. Use the plastic laminate guides when you're in the clinic. Do not use the guides that we have given you today. When you're looking at your guides today, I want you to look for these particular parts. Find the anterior maxillary molds and shapes. You can do that on the electronic one that is on our website. See if you can find the mold popularity. There'll be some sidebars that say what are the most common shapes, sizes, and shades for denture teeth. See if you can find the table for the corresponding mandibular anterior molds to match the maxillary molds. Remember, they'll be listed just below the 3-digit code for the anterior molds and also at the table at the back of the mold guide. See if you can find the posterior molds. And lastly, see if you can find the corresponding posteriors for the anteriors. That chart should be at the back of the mold guide. For our seminar exercise today, you're going to work in pairs with your seminar groups. You're going to try to select a shade for your partners. Please use infection control guidelines when doing so. Then you're going to use the maxillary cast we made several weeks ago and a bully gauge to select a tooth mold that best approximates the maxillary central incisor on your cast. Select a corresponding mold for the mandibular teeth and complete a prescription for the teeth. Have your faculty seminar leader check and sign your form